What sets your company apart, and what do you do differently that gives you confidence in winning?
I'm Josh, the CEO and one of the co-founders of About Fresh. I started out my career as a health worker and health equity activist and predating kind of the commercial market for food as medicine. Um, I founded About Fresh in 2013 after encountering food insecurity up close within my patients. So we're a national nonprofit that's been working for 10 years to just put food into reach for low-income, food insecure households. And over the last 5 or so years, we've been really thinking about how to address affordability as a barrier toward healthy eating. So we developed a financial technology platform that's called Fresh Connect that does just that. It is a platform and a debit card that can be programmed with medically tailored spend parameters integrated across a national network of grocery retailers. Makes it really easy for anyone within a health system or a health plan setting to put money onto a card that a patient can use to go shopping for healthy foods where and when they want, aligned with their healthcare goals. Really excited about all this work and to be here with you all. Thanks.
Tell me about your proprietary moat. What makes you guys really, really different and something that people haven't historically been able just to sort of, pick up at Safeway?
It's not technology. As I mentioned, I was a health worker prior to About Fresh, and the first program that we developed back in 2013 was a mobile market. We operated converted school buses as grocery stores, so it doesn't get more grassroots than that in terms of getting close to the problem that I think we are all attempting to solve for the folks that need it the most. We've really come from a place of ground up social innovation, and obviously our thesis around just getting food into neighborhoods is a little bit misguided relative to what it is that we're doing at this point right now. So our moat really comes from that 10 years of just on the ground operating experience at the intersection of food activism, food security program design, and clinical care, from having been a health worker and experience all the friction that comes along with attempting to connect patients with a non-clinical, social program. And that's really materialized for us on just like an outsized focus on the patient experience. Once you get into that retail setting, making it really intuitive for people to understand what they can buy with a Fresh Connect card. And then I'd say more than anything else, which often goes underrated in our category of like directed spend, sort of like fintech programs, just a super reliable and frictionless transaction experience at the point of sale. So we're not getting into a situation where we are breaking our covenant with our healthcare partners and allowing people to purchase foods that are misaligned with their healthcare goals. And that we're also ensuring, more importantly, that all of our cardholders can buy exactly what they expect to be able to buy.
Give me a case study. Give me a story, real quick, 15 of a family that basically was able to take advantage of About Fresh, and you were transformational.
Yeah, sure. The fun part of my job too is I get to be really up close and oftentimes like buddies, like friends too, with a lot of the folks that we serve, just where we came from. The stuff we think about a lot is culture. So I'll tell you too, like my friend Janie, who's enrolled in Fresh Connect, who unfortunately has passed since too, told me a story too of just over lunch, like how she got to go home for Christmas, because we've seen that increasing purchasing power for food leads to broader gains in economic stability, right? When we think about those other critical expenses. And then I think also family meals, that breaks down. If you're food insecure and you can't afford to feed yourself or your family, you're optimizing for just hunger, solving for hunger, like you don't get to do birthday parties, you don't get to do family dinners, you don't get to do cookouts. And so I think that story with Janie, having the opportunity to celebrate Christmas and her cultural foods is that's the endpoint impact for me.